more infections and deaths are being registered and reported countrywide, unlike before, when such deaths were preserved of the major urban centers in the country. And this has been fronted by the government as the reason for the current countrywide lockdown. When we compared the lockdown of 2020, the first one, the citizens are now in more vulnerable condition, characterized by collapsing businesses, lost employment, and subsequently struggling households, as we all know. They have had their incomes and savings eroded in a bid to reinstate their livelihoods after the first lockdown has replayed. Over the last couple of days since the lockdown was announced, we have been consulting specialists in the field of medicine and academics, economists, statisticians, and we are here to give our views and response to the situation. We are alive to the fact that most families can no longer afford a meal. Parents struggle to return their children to school before they were again returned home. Paying rent for homes and businesses is improbable, and of course the prohibitive cost of medical care. Additionally, the health sector is struggling to contain the pandemic. It is characterized by constraints of hospital beds, intensive care units, ambulances, vetted health workers, and of course, as we know it now, the severe lack of oxygen supplies. Lockdown without development of befitting response or a response system worsens the devastating impact of the pandemic, as is the case now in Uganda. Most failed in urban areas, of course, and rural areas, although the trend shows that if we do not reverse the trajectory, the rural areas too are going to bite even harder, given the nature of systems in the rural areas. Elsewhere, closure of businesses is reducing the ability of the lockdown subjects to earn and survive amid inadequate social protection. We all know the fragility of our social protection systems. The situation is not helped by escalating food, fuel, water, and power prices that are bound to even rise further in the next financial year due to the recent announced tax measures, which we are unmindful of the deplorable state of economic conditions of our people. It is of course akin to milking an unfed cow locked up in a cloud. Ideally, the initial lockdown should have been a stopgap measure to help the country buy time, develop a robust response system, and mobilize the resources. Unfortunately, as we are all aware, the funds mobilized close to 11 trillion that Parliament did appropriate in the financial year 2019-2020 and the 2020-2021 were grossly mismanaged. We are, of course, in receipt of the report of the Auditor General that talk about cost procurements, gross receipts, funds diverted, funds spent on poor supplies. So we can conclude that that was botched appropriation. Furthermore, most of the funds that were given towards to assist the economy, rather than preparing the health sector, which is now outstretched by the pandemic. To the contrary, the unfunded gap in the health sector remained glaring. Given the intent of the pandemic as a result in other countries in our same economic status, more effort would have been geared towards funding and purchasing of vaccines, ICUs, oxygen plants, ambulances, drugs, among others, including PPEs for health workers. The citizens are now facing the consequences of government failure to prioritize their health. The president is increasingly delegating government's obligation to being a regulator and affronting the private sector as the service provider. You have heard at all press conferences, ministers, including the president, trying to put pressure on private sector players as though they have the duty and they are delegating their own duty to that of a regulator. So we believe this is part of the problem. The deplorable state of government facilities and services has created massive demand for COVID treatment in private facilities. And consequently, the cost of COVID treatment has soared. As you know it now, ranging between 2 to 5 million per day in different facilities. So there's no uniformity. The situation is not helped by the low level of vaccination. Aggressive vaccination would have slowed down the spread of the virus, as has been noticed in countries that have undertaken it. However, out of the target population of 21.9 million, remember this is what government has targeted, that at least to immunize 21.9 million Ugandans, close to 870,000 have so far been vaccinated. This translates to a 4% performance since the target was announced. So 4%, if you are an exam, I don't know whether you consider the student as around or absent-minded. At this pace, it will take us 12 years to meet the target. During this time, thousands of people would have passed on due to COVID if we really go by the 4% performance. The sluggish performance is likely attributed to government reliance on COVAX facility other than direct purchase of vaccines from manufacturers. You are aware that the government has preferred largely to rely on donations rather than going out to procure vaccines. The purpose, as we said, of the lockdown is to slow the transmission of COVID. And the purpose of slowing the transmission of COVID is not for the disease to disappear, but for government to buy time and prepare for adequate health care delivery as well as access. Meaning increasing hospital beds available, streamlining oxygen supply channels to the extent of acquiring sufficient oxygen cylinders, oxygen generation systems in regional referral hospitals, delivery of oxygen, ventilators, and medical staff recruitment, as well as their safety. Transforming hospital spaces into high dependency units, HDUs, and ICUs. Converting public amenities into treatment supporting facilities. Increasing ambulance services, hard-to-reach areas like the islands and the highly disease-burdened areas. We would expect these would be the activities in a lockdown. The sluggish pandemic response has also veiled and the static messaging that focuses on preventing washing hands, social distancing, avoiding touching our faces, and it's not in tandem with the community infections and death. Of course, you have seen the head of state dramatizing these messages, and these messages, whereas are recommendable, but the level of infection seems to have surpassed these messages, and we need to all to do better. Therefore, comrades, the latest lockdown pronouncement by the President fell short of adequately addressing the issues that we have talked about and lacks deliverables that should be expected after 42 days. It is on this account that we want to make the following propositions. Namely, that given that the new budget is yet to be executed, through a motion of Parliament, it should be adjusted to allocate more funds towards state vaccine procurement, ambulances, testing kits, drugs, oxygen and personal protective equipment, and the remuneration of medical personnel. 2, to amend the tax measures such as rental income and excise duty that take effect on 1st July to temporarily reduce taxes on rent, fuel, and data. We all know the impact of taxes and how fuel prices eventually impact food prices and consequently reduce the size of the basic basket available to suffering masses. So we believe that the tax measures announced by the Ministry of Finance needs to be revisited and now, before they take effect, to address now the constraints of the suffering families. 3, we expect the President in the circumstances to assent to the NSSF bill to enable savers access mid-term payments as a means of sustaining them during and after the pandemic. We have seen the managers of the fund making half-hearted pronouncements of access that are not backed properly by the law and they look contradictory. We believe the safety of citizens that subscribe to this fund will rely on assenting to this law to enable access. Because the pronouncement by the managers was that somebody in a terrible condition, so what do you do with your money when you're in a terrible condition? So we believe access should be immediate and now, and by assenting to the law that Parliament passed. Next is to engage with private facilities with the intention of agreeing on minimal costs of COVID treatment and offering incentives to these facilities. As long as government continues to look at these facilities as private and therefore fail to rehabilitate their approach to their business, the cost of treatment will remain high. Yet we know that the spread of government facilities is very limited and therefore cannot deal with the pandemic. Next, that instead of food relief, we applaud the approach announced yesterday by the Prime Minister of offering cash. However, we caution that this should be properly done because we are coming out of the food abuse. Cash, as we know it, is very tempting, and we have very weak systems. We have heard that they intend to use mobile money to deliver money to the indigent citizens, but we do not have adequate data. If we consider funds available per capita and available to the poor, we envisage a problem. So we invite the government to explain how money is going to be transferred to the citizens so that there is a democratic conversation about its feasibility and how the holes therein can be planned. Part of the problem, comrades, is that the government would allow citizens to believe that the pandemic is their product, is their project, and therefore they need no advice. So we invite them to make the solutions democratic, to be debated, so that citizens can participate in alleviating the problem. We would like to comment on the lockdown of the closure of schools and the free movement of citizens. We are aware that COVID-19 did originate from outside Uganda. Has there been a sustained mechanism of restricting people entering our country at the border points? The population would be reasonably protected from the depression and the financial loss that is associated with the lockdown. But the failure, as we know it, to sustain the mechanism of restricting people at entry points, like the mandatory 14-day quarantine and testing, prompted the decline in phase 3, which is community transmission. Even then, had there been COVID surveillance by way of massive testing to identify hotspots throughout the country, a cluster containment strategy would be employed to avoid large local outbreaks and a national lockdown. We are now aware that government says that people can come through the airport and other border points as tourists as long as they are immunized. We find that approach problematic because there are no medical reports to the effect that once you're immunized, you cannot again be infected and again pass on the same problem to citizens. The same measures initially undertaken at entry points should be reinstated, namely that testing should be done, and where there's no clarity, quarantine. But this time round, quarantine centers should be properly managed, not made money-minting adventures for regime hunger zones like it were before. On the closure of schools, it's very regrettable that a large number of students in schools tested positive for COVID-19. Whereas this age group is observed to be very resilient to COVID-19, with the least recorded death, and that many COVID-positive students were asymptomatic and others with very mild symptoms and are likely being managed from their homes. We also know of a few cases that needed high dependency unit care and ICU care. We are aware that there are those cases of students who have passed on, and we grieve with their families. However, we believe that the decision to close schools was hardly thought. In the school environment, isolation would be possible by way of converting dormitories into isolation treatment centers, and government would easily identify and manage extreme cases with a preferential and specialized care, especially where parents are financially challenged. Otherwise, the COVID-positive students have returned to the different destinations of the country and are locked in together with their families. In some families, members are more vulnerable due to compromising and other underlying health issues. This is very devastating and defeating because transmission is within the households. What about a decade into the phase of uncontrolled transmission? The issue of students randomly returning home to their home is not helping our situation. We have the view that it could have been phased, it could have been done differently because schools have more robust structures to manage testing and treatment as compared to communities where there is no control and these students in their communities are at large and they continue to spread. We therefore would like to imagine that if it were about us, we would intensify testing by investing more money in testing and more vaccination. We would continue to profile underlying issues with patients because we have been informed that by the health workers that there are a number of deaths that are avoidable because of case management in those hospitals. That once patients are admitted, they are detached from their families, and therefore care is very limited. And therefore, some of the deaths that are being reported, had we managed a better system of managing these cases, the mortality rate would have been even lower. So we invite government to revisit the care system, to revisit the treatment protocol, the health facilities, by involving families in the care system. And in some of these facilities, families should be helped to extend care to the sick. And they should be given, the caretaker should be given the same protection as given to the health worker. Families are reporting their loved ones dying in isolation and without information. In effect, we are demanding for a transparent treatment system. We are demanding for a more transparent protocol of treating the COVID-positive patients, because there's evidence that the lack of transparency also accounts for some of the deaths that have been avoided. We believe that the issue of the lockdown should have been faced, and therefore it's not late to be revisited. And this is our proposal, that for every 2 weeks of a lockdown, the country would also have a 5 days round. Every after 2 weeks, we will have 5 days to test the velocity of government actions. Because if we simply lock down without action, it's like running away from the epidemic, but we also find it existing when we come out of the hiding, wherever we are. So after the first 2 weeks, we have 5 days break. A week lockdown again followed by a 5 days break. When we do this, it will facilitate government in understanding whether what they are doing is working without necessarily breaking down the economy. Because sustenance of our people is not possible when a lockdown is not followed with other measures that will keep the economy going. After all, the same people are supposed to take care of the medical bills of the sick, but without an opportunity or a window work. Because massive testing, like we have talked about, it informs the entire policy of lockdown, whether it is achieving the purpose. And if you lock down without testing, it is inconsequential. We are also proposing that for every 2 weeks of a lockdown, the government would engage in selective testing to test whether the action of isolation, of a lockdown and immunization are also working. And the health workers are proposing that the government should to carry out 2 types of tests, and we agree with them. One, to start carrying out antigen tests. Antigen tests where a COVID-positive patient is identified and medically managed. 2, carry out antibody tests to identify people who have developed immunity against COVID. Because when you immunize and you do not test whether people have developed immunity, it will mean that you are carrying out an exercise without test. The antibody test is very cheap and simple to perform. It is as simple as carrying out a malaria test or a pregnancy test. And it costs barely $4, approximately 15,000 shillings. Compare that to an antigen test, which costs between 180 to 200,000 shillings. The massive antibody test will inform us whether Uganda has reached a point of herd immunity. But most importantly, it will inform the policy on vaccine procurement and vaccination. where we have serious problems. Countrymen, it is our view that the current situation, as government has announced variously, cannot help us to achieve both the targets for immunization and the targets for treatment of the sick. So we invite government to be more transparent in the way they are managing all these issues to enable citizen and expertise participation. Finally, we are receiving reports from traders, especially in Kampala, that the lockdown was announced at 10 o'clock on Friday and immediately began to bite. They were never given an opportunity to open their business premises to access what they call their backup resources. Some of them have their funds, money locked up in the shops. There should be an arrangement that can allow them access to be able to survive under the lockdown. We are aware, countrymen and women, that many traders keep their money in their shops, and they never had opportunity to return on Saturday to collect this money. So we are requesting that a window can be opened, a managed window, because these people work in regulated places, for them to come and access their money and be able to support their families under the lockdown. Thank you so much. We believe government will listen and should not make COVID their preserve. It's not their property. It's a global pandemic, and management must be transparent. I thank you. Let me do a vernacular version. Utusanze twemagaza. Alipoota ezivaayo eziraga nti ensimbi ezo zaakozesebwa ebintu ebirala, zaaliibwa n'oggula ebintu ebitatuuse eby'omutindo ogwa kibugwe, ziraliikiriza eggwanga. Embeera y'ebyobulamu fenna gye tuli yeraliikiriza. Omuggalo ogwasooka gavumenti yasuubiza yeteekateeka okugema abantu obukadde 21. Bwe twogerera eddagala eryakajja lisobola kugema abantu 87, ebitundu 4 ku 100 kwabo abaasuubirwa okugemebwa. Kiba kitegeeza nti tutambula bwe tutyo, abantu gavumenti byateekateeka okugema bajja kuggwayo mu myaka 12. Nze naawe abanaabaawo be banaabala ebisigadde emyaka 12 nga tutambudde tutyo. Enteekateeka ey'akasoobo eyo esobola kunnyonnyolwa bunafu bwa gavumenti kulowooza nti eddagala erigema bajjajjiwa buwi, era ng'erinze bagazi ba buyambi kugiwa. Ensi ezigezezzaako okulwanyisa ekirwadde kino tewali erinda jjuwa, zikwata ensimbi ne zigula eddagala erigema n'erijjanjaba. Mu kaseera kano nga amalwaliro aga gavumenti n'ag'obwannannyini tegalina bitanda, tegalina oxygen, abasawo nga tebamala, abasawo abaliyo nga bakoowu, tulowooza nti eggwanga liri mu katyabaga, era waliwo ebyamangu ebirina okukolebwa bye tulowooza nti tebirina na kulinda. Ekisooka, twagala gavumenti mu bwangu ddala ekiteeso mu Parliament oba esaba okuyambibwako tugiyambeko, ekiteeso kijje ekijjulula embalirira ebyategebwategebwa mu mbalirira y'omwaka gw'ebyensimbi okutandika nga 1 Julayi, embalirira esobole okuddamu ebibuuzo bannayuganda, esobole okugula eddagala erigema, erijjanjaba, erikozesebwa n'okwongera okufuna abasawo abanaayambako okulwanyisa ekirwadde. Abasawo be twogerako situbaagala mu malwaliro ga gavumenti gokka, naye twagala gavumenti olw'okuba tuli mu mbeera ya katuubagiro efune abasawo ne beenaaweereza mu malwaliro g'obwannannyini, kubanga weegali tegasinga gavumenti obungi oluusi n'obusobozi mu bitundu ebimu. Era tusaba gavumenti mu bwangu ddala ejjulule enteekateeka y'emisolo mu mwaka gw'ebyensimbi ogujja. Omusolo ogumu eguyimirize, omusolo ogumu nga ku mayumba, omusolo ku mafuta, n'omusolo omulala gwonna oguyinza okulemesa bannayuganda okusobola okwaŋŋanga embeera gye tulimu, erindeko emberedde mu nteeko. N'omusolo gwe baateeka ku intaneti olw'embeera y'ebyobulamu n'ey'obusuubuzi ekyuse, gugira nga guyimiridde bannayuganda basobole okuyita mu mbeera gye balimu ey'akatuubagiro. Pulezidenti w'eggwanga mu bwangu ddala assa omukono ku tteeka ery'ekitavu ky'abakozi, abakozi basobole okufuna ku nsimbi zaabwe zibayambe mu mbeera gye balimu. Enteekateeka y'abakulira ekitavu gye balangiridde temala, bo bagitaddewo nti bw'owulira ng'oli bubi nnyo, bo balinze muntu abeere bubi, abeere ku ndeebolebo, ne tubasubira abantu kugyayo ensimbi okuteekateeka okuziika kwabwe, anti n'okuziika kwa bbeeyi bulabe. Twagala abantu bafuna ensimbi nga si balwadde naye olw'embeera eriwo. Kyekyo Parliamentary yayisa mu tteeka ery'ennongooseza mu tteeka ly'ekitavu lye tubanja Pulezidenti asseeko mangu omukono. Ekirala, enteekateeka ey'okugabira abantu emmere, twagiraba nti abaakwasibwa okugaba emmere baali bayala okusinga baali bagitwalira. N'olwekyo enteekateeka ey'okuwa abantu ensimbi yandibadde eyambako, naye tuwa amagezi naye ekwatibwe n'obwegendereza, era ensimbi ezo zireetebwe mu Paalamenti tuziyise mu butongole, tutegeere n'abantu abatagyeted, abantu abazigenda okutuukako n'ebitundu bye balimu. Zireke kufaanana nga nsimbi za kwebaza gavumenti kuba mubuyinza myaka 35. So ensimbi zino tulinze minisita w'ebyensimbi gwentegeezeddwa nti ajja kulayira olwaleero kyabansookera kaakole ajja ayanjulye Paalamenti obungi bwazo n'abantu bagenda okuzifuna, zireke kufaanana nga ebijanjaalo biri bye mwalabako ebyalimu awulukuumi n'ebikongolero. Ekirala, gavumenti embeera y'okwekangabiriza egiveeko, etulinde bannannyini malwaliro ag'obwannannyini bakkaanye ku nteekateeka y'obujjanjabi n'ensimbi ezisoboka bannayuganda ze basobola okusasula. Ekyo ekikole naye ng'ebawe ebisuubizo obakendeeza ku bintu ng'emisolo basobole okuwa eggwanga obujjanjabi, fenna obusobola okuyisa mu katubagiro ke tulimu mu kiseera kino. Twagala kwogerako ku nsonga y'ekiggala amasomero ate n'ensonga ya okubanga ensalo zaffe n'ebisaawe biggule. Ku ntandikwa mu ggalo ogwasooka ekisaawe ekyaggalwa, tulowooza nti ekisaawe kisobola okusigala nga kiggule, naye nga mu kukiggula kireke kubeera nga kifulukwa. Wabeerewo enteekateeka nti abayingira mu ggwanga bakeberebwa newandibadde baagemebwa, nga omukulembeze w'eggwanga bwe yagamba nti awanga wagemebwa oli wa ddembe okujja n'otambula nga bw'oyagala. Tewaliiwo bukakafu bwa science bulaga nti omuntu ng'agemeddwa oba bitufuula mu ggwanga. So ekyokubanga omuntu agemeddwa kireke kubeera nga kyekitusinzirwako okukkiriza abantu okumala gayingira mu ggwanga lyaffe. Abantu bakeberebwe, owali okwekengera n'obutali butangaavu mu mbeera y'omuntu asibwe mu mbeera ey'omuggalo oba karantini okutuusa nga embeera yetegerekese, tukakkanye embeera y'okufuna obulwadde obw'enjawulo, kubanga tutegeezeddwa nti ne COVID tafaanagana. ensi ez'enjawulo zirina ebika ebyenjawulo. Kyangu nnyo ndowooza ebika ebyenjawulo okuyingira mu Uganda nga biyita ku kisaawe n'amakubo amalala agava mu nsi endala. N'olwekyo ete kulekebwa bulekebwa nga bwe kyalambikiddwa. Ekyakugala amasomero tulowooza nti kyakwatibwa mu ngeri ya kibugwe n'okutya. Wandibaddewo oba oli awo obwegendeza kubanga amasomero mateeketeeke bulungi okusinga amaka gye twasindika abaana bano. Amasomero oba oli awo gandibadde mangu nnyo okukebererayo abaana n'okubajjanjabirayo. Galina ebisulo ewandibadde akatubagira ak'amaanyi basobola okukuumira abaana abo ne bajjanjabibwa. Nekiyamba n'abazadde abatalina nsimbi kutwala abaana baabwe mu ddwaliro okujjanjabibwa gavumenti nga bali mu masomero. Naye ekyo tekyakolebwa. Tulowooza nti ensonga lwaki obulwadde bwesoze mu masoso g'ebyalo abaana bano gye baalaga. Oba oli awo lesoni nnene kyakuyiga kyamaanyi eri gavumenti singa tufunye ebisoomooza nga bino wabeerewo okwewuulira kubikola n'okwebuuza okumala okusinga okukola kanagweramu eyo. Twagala kusaba bino wammanga bikolwe mu bwangu nabyo okugatta ku bintu tusoose okwogerako, okugula amangu eddagala, okugema bannayuganda abawera mu mbeera eyakirindi, okutuukira ddala ku bulwaliro obali okumpi eddagala lituuke eri batuukeko bagemebwe naddala gye tulowooza oba ewali information emala amawulire agamala nti obulwadde bungi okusinziira mu bitundu gye bali. Eddagala erijjanjaba lireetebwe liweebwe n'amalwaliro ag'obwannannyini ku ssente ensaamusaamu. Ekisembayo tulowooza nti omuggalo guno ogwalangiriddwa gusobola okubeera okutemebwatemebwamu emitendera. Emitendera gino nga mulimu nti buli luvannyuma lwa sabbiiti 2 wabeerawo okwetegereza obanga enkola ya gavumenti ekoze oba tekoze. Obwadde si bugenda kuvaawo nga tubwekwese era tunaabaawo omuntu gye tuweekwese kujja kumusangawo. So kyamagezi nti buli ekikolebwa wabeerawo omutendera ogunyonyola ogulambika oba okubeerawo kituuse. Lockdown mu mbeera gye tulimu ey'ebyenfuna tulowooza nga temenyeddwamu mitendera eyinza okwongera kwonoona bwonoonya akalembereza akaliwo, ebeerewo naye ng'emenyeddwamu nga etambulira wamu n'okugema n'okukebera. So si kuggalawo bugazi nga tewaliwo nteekateeka nnuŋŋamu yakukebera na kugema bantu. Era mu ngeri y'emu twagala gavumenti ng'egyekuttemu obujjanjabi. Bannayuganda beemulugunyiza nti abantu abamu abafa tebandifudde singa wabaddewo enteekateeka y'obujjanjabi ennuŋŋamu. Okujjanjaba abalwadde kulimu ekizikiza, tekulimu butangaavu. Abantu bwe balwala baggalirwa mu malwaliro ne batatuukibwako bantu baabwe. Tulowooza nti enkola y'obujjanjabi yandikyuse n'abajjanjabi ne baweebwa ebibakuuma nga bwe biweebwa abasawo okwekuuma obulwadde, kubanga tukizudde nti abasawo abajjanjaba ate okulabirira abantu ng'abantu n'emibiri gyabwe n'ebibatambulirako tebabisobola. Waliwo abafa nga tebandifudde, waliwo n'abafa enjala betuwulira nti oli yadde mulwadde naye yafudde n'enjala, kubanga abasawo b'enkola yaabwe yakujjanjaba. Abalala bebajjanjaba tebamanyi bye balya ne bye batalya tebabimanyi, nakyo kivuddeko abantu okufa. Tulowooza nti enzijjanjaba ebeeremu obutangaavu ate ne families abantu bano abadde bwe bava zibeere nga zituukibwako okutegeera obulungi embeera y'abantu bano okusinga okubasuula mu ddwaliro ne balinda bulinzi okubayitira omuntu waabwe bamunone ne balina. Nkikonyeeko ndowooza okuggyako tebadde sikonyeeko nti abasuubuzi naddala mu eri ey'akasiita batuukidde ne bategeeza nti omuggalo bwe gwalwangirwa ku Lwokutaano ku ssaawa 4 ez'ekiro baaweebwa mukisa kubanga gwatandikirawo okukola okusobola okuddayo mu maduuka gaabwe okuggyayo ebintu byabwe ebyonooneka omuli n'ensimbi ezandibayambye. Prime Minister muteekateeka y'engalo yakwasula obuvunaanyizibwa twagala abeekujja alambika okuyamba abantu abo basobole okufuna ensimbi zaabwe n'ebirala by'omuwendo byaggalira mu maduuka tulina bakomooneka omuli n'ensimbi ze beetaaga okulabirira abantu baabwe. Tulowooza nti kikulu nnyo kikolebwe mu ngeri ennungamu kubanga abantu bano webakolera mu kisaawe basobola okukolerwa enteekateeka okuggula akeedi ezo mu ngeri etali ya kulwanagana ne baggula amaduuka gaabwe ne bajjayo bye beetaaga okulabirira famire zaabwe. The questions we are available to answer them.
Okay. Oweekitiibwa ku mulundi gulimu wagezaako okugaba emmere eri abantu bammwe oba eri abalonzi bammwe gavumenti ne bayingira ndowooza Honorable Sonia abakirozaako mwandyagadde ku mulundi guno okugaba emmere eno platform Oweekitiibwa Nabbanja byatugambye.
Ekyemmere fena twakiraba kyalimu obulemu nti tewali muntu sekinoomu alina busobozi kuwa buli muntu mmere. Abaka baali bagezaako kumubiriza bumubiriza era baakikola kubanga emmere ya gavumenti tiyatuuka baali bagirindiridde. Sandiwadde magezi kusaba kwe twayitamu mbeera ya kugaba emmere kuddamu oba oli awo wabeerawo omubaka yenna ayandiyagadde okuyamba abantu be okuva ku ntandikwa abamu fe twali tulowooza nti ensimbi zenyangu okukozesa. Obulemu bwokka obuliwo nti enteekateeka ya gavumenti n'ennambika y'omuggalo ey'ebitege eggula obuduuka ate n'eggala gye bajja ebintu era eyinza okusuzula nga ebintu bizibu okufuna naye alina sente ne bimubula. Kyokka atugamba nti omuggalo gubeere nga guteekebwamu emitendera wabeerewo okuddirizaamu mu nnaku ezimu ate n'okukebera we tuba tutuuse mu ggalo ogwo naye nga ekyokugaba emmere enkalu kirimu obulemu. Yes, sir.
Namaye Moses, I work with NBS TV. According to your press statement, all those things requires a time frame. Are you giving time frame maybe for Parliament to come back from a council recess and work on these things as early as possible?
For the record, Parliament is not in a recess. Parliament is in session. We don't have a problem that ministers were still being vetted, and the vetting process was completed on Thursday last week. I am being advised that they are being sworn in today, so we expect them to immediately swing in action and come to the House, and we address this matter as the House of Parliament. So we are waiting for them.
Tuyate Marojo Simba. Ensimbi zino zibagambye okuteeka ku masimu g'abantu. Olowooza wandibadde okola kiyinza okukolebwa abantu bano bafune ssente zaabwe abali mu bwetaavu?
Ekisooka n'omuwendo gw'ensimbi nga bwe tugambye twagala tugutegeere gwenkana ki, kubanga ekimu ku bizibu ebiri mu Uganda nti kye bayita best basket mu lulimi lw'ebyenfuna tekiri defined nti kiki omuntu kyeyandibadde agula n'okakasa nti obwetaavu bwe obusookerwako abufunye era kigula ssente mmeka. Yensonga lwaki tugattise nti waliwo obwetaavu bw'okugyawo emisolo okuyimiriza emisolo egimu egirinyisa ebbeeyi y'emmere. Kati obwetaavu obusinga obukulu bwa mmere, ddagala n'amafuta oba amasannyalaze. So tulinze ebisabo by'ensimbi alambike omuwendo gw'ensimbi ogwogerwako, atubuulire n'ye kyatwalanga bwe tuba tututte CPI, Consumer Price Index, ensimbi ezisobola kugula biki okusobola okuyamba bannansi okufuna obwetaavu obutandikibwa. Tukirindirire kubanga omuwendo tugumanyi, ekyokukozesa essimu tukyogendeko kirina obuzibu nti abantu betwogerako nga bali vulnerable era abasinga batalina masimu. Kakati obanga oyagala kugamba ogenda kukozesa ssimu ate nga botageti nga bwemu kubatalina ssimu ogenda kukikola otya? Tulinza okunyonyola kwa minisita, tulowooza nti enkola erina okuba nga yanjawuloko ekyokulangira obulangizi tugenda kukozesa ssimu. Waliwo obwetaavu okukozesa goodwill y'abantu ya community. Abantu baffe gye babeera bamanyi abantu abalina obwetaavu, so tebamanyiddwa bannabyabufuzi bokka, abasinzire ne kampani bakulunga olugezigezi twaweereza sente. Yes, sir.
Thank you, Steve. My name is Jackson, the rest of the CPS. One of the stated that close to 10 trillion was misused under the reports are out. When I committee started looking through the process, because even the budget you are calling for to be brought back to Parliament, just it's going to be used by the 17 using the other 10 trillion. So when are you starting?
Well, for starters, accountability is eternal unless you are going to your maker. As long as you live, you will account for the funds that you use. So we cannot stop the process of helping citizens because some thieves are hovering over ministries and other government agencies. The process of availing money will continue, and Parliament, not simply accountability committees, will scrutinize and they ask questions. I want to assure you that the committees are ready themselves. They are taking shape. Remember, members have not yet been allocated to committees. The process is ongoing. We believe it will be the first activity immediately at the resumption of Parliament. And the whips will be able to distribute their members in the committees to begin work in earnest.
Whether you should advise your members to get permits for this.
There's nothing like a permit to distribute food, you know. Yeah, I want to differ. I don't believe with that approach, and I want to encourage members to desist from that approach. It is counterproductive. I want members to concentrate in Parliament and demand that the government actually, to whom people subscribe money by way of taxes, does its job. Members do not collect taxes, and citizens should stop pressurizing members to giving them money and food. No member of Parliament collects tax. So I want to invite members to be here and demand that the government acts on its responsibility. No pressure on members of Parliament. They do not have that money. It is a misplaced, kind of agitation. Bannayuganda njala kubategeeza ababaka ba Parliament sibasolooza mu kibuga. Tuleke kuteekawo mbeera egoba ababaka ba Parliament mu bantu baabwe, naye tukole nabo okulwanyisa ekirwadde. Ababaka ba Parliament njala kubasaba amaanyi bagateeka wano ku Parliament. Gavumenti abandi bawa omusolo ekola obuvunaanyizibwa bwayo. Omubaka wa Parliament yenna ayagadde okukola nga ye akikole nga ye, naye si bwe buvunaanyizibwa bwe. Kubanga ojja kikola okukwata okwekweka abantu abakulonda. So ssente z'abantu ziri wano, ababaka babeere wano okutayiza abazibba, okusesemya ababba ezaasooka zigende mu bantu bevunaanyizibwa tulina okukola. Yes, sir?
Yeah, Aaron, from NTV. I want to draw your attention on the question of enforcement. In the first lockdown, it was more like security was competing with COVID-19 actually to kill our people. So many people were shot. And in this second lockdown, there is a recurrence. So far, we have registered about 2 cases of people being shot. There was a case in Bugembe, there was another one in Kasese, and we expect more of such scenarios. And I haven't had to come out and comment on such because it's really out of hand.
We certainly shall comment on so many things, including that. But we are coming from a background of lawlessness. That very issue you're talking about has no legal framework. The enforcement currently as to where has no legal framework. and every individual wielding a gun believes they are on the law on themselves. It certainly is the culture of the government that these people, some of these people believe to be serving. As citizens, we must always reject this approach to enforcement. We believe that the enforcement should be civil. No Ugandan wakes up to die. But we must be alert to the fact that citizens can become desperate. I can assure the country that as long as the approach of government is uninspired and insipid like it is now, we don't have really a rundown between security and people looking for survival. So which is why we are concentrating on government programs that look uninspired, that they are directed towards addressing the problem instead of hunting down citizens. I can assure you that I take it that even people hunting down citizens are as angry and hungry as the citizens. So a proper program to address the challenge enemies with proper legislation to attend to it is the solution. Thank you so much for your time and patience. Era buli kati ensonga lwaki omuggalo ogwokubiri